Why is your FEV1 number important for COPD diagnosis? Imagine trying to breathe through a straw that keeps narrowing. That's similar to what happens in your lungs when you have chronic obstructive pulmonary disease. To figure out how much your lungs are affected, doctors use a test called spirometry. This test measures how much air you can blow out and how quickly you do it. One of the key numbers from this test is called FEV1, or forced expiratory volume in 1 second. It tells us how much air you can forcefully exhale in that first second after taking a deep breath. This number is very important because it shows how well your lungs are working. If your FEV1 is low, it means your airflow is blocked or restricted. That's a sign of COPD. During the test, your doctor also measures your forced vital capacity, which is the total amount of air you can exhale after taking a deep breath. They look at the ratio of FEV1 to FVC. If this ratio is less than 0.70 after using a medication called a bronchodilator, it confirms airflow obstruction. This is a key part of diagnosing COPD. The FEV1 number is then compared to what's expected for someone your age, height, gender, and race. This comparison gives a percentage called the predicted value. For example, if your FEV1 is 70% of the predicted value, it indicates some airflow limitation. Based on this percentage, your doctor can classify how severe your COPD is. If your FEV1 is 80% or higher, it's considered mild. Between 50 and 80% is moderate. If it drops below 50%, it's severe. And if it's less than 30%, it's very severe. The lower your FEV1, the more your lung function has declined. This helps your doctor understand how serious your condition is and plan the best treatment. It's also useful for tracking how your COPD changes over time. If your FEV1 drops faster than normal, it might mean your disease is getting worse. Monitoring this number helps doctors decide if you need more medication or other treatments. So, your FEV1 number is a vital piece of information. It confirms whether you have airflow obstruction, shows how severe your COPD is, and helps track your progress. That's why spirometry testing, especially measuring FEV1, is the gold standard for diagnosing and managing COPD.